The last case we're going to present to you today is a 40-year-old female. She was admitted with acute abdominal pain to the emergency room. Abdominal ultrasound showed gallstones, but no evidence for bile duct dilatation. However, lab values showed elevated bilirubin, alkalic phosphatase, and gamma-GT levels, and Professor Dancer will now perform an EUS to determine for bile duct stones.
Yeah, hello. We will show our last case. Now this young female, the colleague introduced already with an episode of acute abdominal pain yesterday. And now I'm in the duodenal bulb already, and we can see the bile duct here. And up to now, I did not see some stones. Her pain resolved yesterday. She's actually pain-free, and the question is if we should do ERCP afterwards. Now, you see, what I didn't think about finding was this, where this big lymph nodes in the liver hilum. That's a little bit surprising.
The arrow. Yeah.
Here. And yes. And we see the gallbladder at 12 o'clock, and then lymph node here of about 14 millimeters, and the bile duct here. I'll show you from the duodenal bulb now. It's about 3 millimeters, not very enlarged. I try to follow it now down. Portal vein and these big lymph nodes, and if you follow the bile duct, we can discuss about this here. It's in the pancreatic head, near to the papilla, I think. Bile duct is enlarged, but no real stone. Little bit sludge, perhaps. Yes. I think we see a little bit sludge here. I try to visualize for you. This region here. But we always have to think about having something else. It's not very suspicious here. We have pancreas, pancreatic duct, and bile duct now. Pancreatic duct. And the bile duct is narrowing here within the pancreas. But there is the stone. We have it. Now there is the stone.
Yeah.
Okay.
Very clearly. Good.
Yeah. And therefore, it's the last case here in this room. It's our ERCP room, and I think we can go to ERCP straight through with this picture now. I think so. You see papilla and both ducts here, papilla region. And the AOS is it's a simple method in cases of doubt to find out if someone has a concrement in the stone in the bile duct and needs ERCP. She's a young woman of about 42 years with a high risk for pancreatitis, and I think it's making sense to do that in these cases. Yes. With these lymph nodes, we have to follow them. I'm not sure if it's due to the acute episode of bile stone on cholangitis. We have to see.